Good afternoon and welcome to United TV. This is our Bariatric Friday event. My name is Kemal Erkan and I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Great to be back again on another wonderful session of Bariatric Friday.
Thank you for being with us. Today we are going to discuss the patient perspective and longer life expectancy related to bariatric surgery. We have some points that we need to make, and I have some questions. Patient perspective, this is a very broad topic, actually, so it can be anything. So we try to kind of summarize this and try to make things a little bit easier for people to process. So if you can start overall, what is patient perspective? What do we understand from that, from the patient who's going through the bariatric surgery or patient who's struggling with morbid obesity who may be going through the surgery?
Absolutely. The most common combination of emotions expressed by patients, Kemal, is really one of excitement and apprehension at the same time. And patients find that very difficult to deal with sometimes because it may be a new combination of emotions for them. And it's important for us to reassure them that this is very normal. They feel extremely, extremely excited at the prospects of the results of bariatric surgery, which is liberate themselves from the ravages of obesity with which they have usually struggled for years. You know, the most common answer you get when you ask patients, how long have you struggled with your weight, is they will say, all my life, or since I was a teenager. And we're talking about people in their 40s, in their 50s now. So a struggle that has been constant, a daily struggle in a way, right? So they're excited at that prospect. They're also excited at the prospect of not having to deal with illnesses related to obesity, with which they also have struggled, as the years have passed. Every time they go to visit their doctor, the news about where their high blood pressure is, where their diabetes is not comforting, right? Their doctor will be adding more medication because as long as obesity is there, as long as obesity is getting worse, their diabetes is getting worse, their high blood pressure is getting worse. So the prospect of having a situation where there is a complete turnaround of their health, where they wouldn't have to worry about these medical problems, where they would be tired, that excites them, and rightly so. But at the same time, they know they're undergoing surgery. And although for you and I, Kemal, who are extremely familiar with bariatric surgery, we know the high level of safety of bariatric surgery. We don't look at bariatric surgery just because we know that the safety level is so high, but
Dr. Irgau, hold on one second. I think I don't know.
For us, because we work day in and day out.
Dr. Irgau, we are going in and out with the connection. I don't know if it's from your side or my
really?
side.
Okay.
Just want to make sure that I get some confirmation from our people here. We can probably continue, but I'll stop you if it becomes more.
Absolutely. Absolutely. So, from our perspective as
Okay, I think there is something happening.
Healthcare workers involved in bariatric surgery. Still a problem? Is it my microphone, maybe, do you think?
There is, it's going in and out, and what I'm trying to figure out if it's coming from you or me. So,
okay, so I will look at my internet.
Yes,
my internet is good.
It seems like it may be on your side, but I don't want to.
I'm just going to check my internet, Kemal. Give me 1 second.
Right. So while you are doing that, I can actually explain some of the perspective stuff. So what we see with our patients, when I look at the perspective, so usually my view is I'm looking at those patients in our case conferences when they come back second time, or when they drop out of the program. So that actually makes me think of the perspective a little bit more. And again, this is just from my side. So why do I think about these situations? So patient actually comes back second time, And immediately my first reaction is looking at their first consult BMI and their weight. And, unfortunately, every time, almost no exception, 10 to 15% higher BMI from the last time they were with us. So this is kind of like, the patient perspective, thinking that did they actually know this was going to happen? Because we have the same reaction when patient comes back, when they finish almost everything, and they're like, oops, I changed my mind. And then I'm not going to go through. And then again, immediately I'm like, well, she'll be back in 12 months and she'll be 15% heavier than she's right now. So can I stop this? That's my kind of like perspective on these issues. Dr. Guy, I think your connection is okay now?
Yeah, that is great. No, absolutely. I mean, and that second guessing is part of that apprehension that comes with bariatric surgery, but it's not just apprehension. Sometimes it's also a sense of guilt that is related to that stigma of obesity that we talked about many times in our session, which means that patients look at themselves as a failure if they opt for bariatric surgery, as if it was in their hands to change their situation. But we know that that's not the case. It's a biologically driven disease, which in the right environment becomes intractable. So that an individual at an individual level has less than 1% chance of getting rid of obesity by themselves once obesity gets to those levels, right? So, I can give you an example of a patient I saw today in my office about 8 to 9 months after bariatric surgery. That patient lost 175 pounds already, Kemal. And that patient now is going back and forth with his doctor because they're playing catch up with reducing medications. Every time they reduce the blood pressure medication, it needs to be reduced even more. So that person is not taking any blood pressure medications. The diabetes medications have been cut in a quarter of what they used to be. And that patient was using a CPAP machine every night for the last 20 years. Now they're not using the CPAP machine. They sleep so much better without it. Now, that patient is an attorney, come on, right? So somebody with high level of function and also education. Now, by the way, that person has offered very much to come in shows like this and share their experience because they want to make sure that patients also have that perspective. But the point that patient made to me is that they felt sorry. They haven't done this 10 years ago, right? It doesn't think about it 10 years ago, but they were not ready. There was this back and forth second guessing, and that meant struggling for obesity for 10 more years instead of addressing it at an earlier stage. So patients' perspective is like that. But once the surgery is done, once they get through the surgery and they see the results, they feel immensely happy. It's just a rebirth of sorts for them, really, because they're able to recapture this new life. And that is the case for the vast majority of patients.
So if we were to go into the life expectancy and health benefits, can you discuss how surgery actually impacts the life expectancy and therefore the specific health benefits to contribute to patient perspective?
Absolutely, absolutely. So the first question would be, does severe obesity shorten one's lifespan? And the answer to that is yes. Do we need to go and look at research papers for that, Kemal? No. You know what we should look at? We should look at the policy of life insurance companies, right? What do they do? If you have a body mass index greater than 30, certainly if the body mass index is greater than 38, some of them will automatically reject your application for life insurance because they think you're too high for risk, right? Others will charge you premium fees to give you life insurance because what? Those life insurance companies, which are the utmost experts in really understanding life, expectancy, people know that high body mass index is a risk factor for early mortality, and therefore they want to take a risk for that. And I have had patients come out who told me plainly that their life insurance application has been rejected because of their body mass index. And these are patients with young families who absolutely need life insurance as a basic, part of their financial planning. So we know obesity cuts lives people short, right? The question now would be, if you get rid of obesity with bariatric surgery, do you see an improvement in life expectancy? And the answer to that is absolutely. And there have been several studies come out that have demonstrated this without any question. Studies showing that the mortality falls as much as 40% after people have lost enough weight, when they started from body mass indices, greater than 40 or so. There was a study at the Veterans Hospital System in the United States, which looked at outcome of bariatric surgery in Veterans Hospital patients who tend to be male, very high body mass index, central obesity, which means also the surgery itself is potentially high risk. And they demonstrated really much, much better life expectancy for those who undergone surgery compared to others. And then, of course, there is the classic Swedish obesity study, Kemal, where in Sweden, they actually prospectively studied. They followed patients, about 2,000 patients who underwent bariatric surgery, 2,000 patients with similar body mass index who didn't have bariatric surgery but had traditional treatments, and they followed them for up to 11 years. And they could see that the people who didn't have surgery were dying at a much higher rate compared to the ones who had surgery. So means that bariatric surgery actually increased the life expectancy of these patients. More recently, there was a study in the state of New York looking at actuarial data and comparing that data with similarly matched patients who underwent bariatric surgery. And they could see that if you had bariatric surgery, you had actually extended your life by as much as 7 to 8 years, right? On average, which in terms of population differences, this is actually a huge gap, Kamal. So there is no question that bariatric surgery does increase life expectancy. Of course, the argument that one has to make and see is that, do we only look at the benefits of bariatric surgery in terms of improvement of the overall health, or do we look at the safety of bariatric surgery as well, right? Because, that will have an impact, right? But with the safety level that we have with bariatric surgery right now, where bariatric surgery carries a risk of severe complication, which is extremely low, then the advantages of bariatric surgery in terms of expanding life expectancy keep on increasing, right? The safer bariatric surgery is, the higher the quality of care, the more prominent will be those advantages that we get with people losing weight.
So let's talk about the challenges a little bit, and then again from the patient perspective and from the surgeon perspective. What are some most biggest challenges you have ever encountered with the patients after the bariatric surgery?
Yeah, absolutely. So I think bariatric surgery is clearly a life-changing process, right? Because daily life of a person who's had bariatric surgery is going to be different from their life before, right? This is obviously physically they are changing, right? They're losing weight. The way in which they have to eat is going to be different, right? There are certain foods that may be agreeable to them or not. They cannot go to foods just as something that they will go to because they are stressed, right? Because their ability to eat a certain amount of food is going to be limited, right? Relationship that they have with their loved ones, with their friends, with their community is also going to be different, right? So there are a number of challenges that require absolute preparation before bariatric surgery. And that is why we have this extensive preparation, because we want our patients to be prepared not only on how they have to eat, not only in understanding things like what is a protein, where do we find the highest level of protein, what is carbohydrate, what is fat, okay, and how much protein should I have, what are vitamins, what kind of vitamins should I have. Not only that, but we also have to prepare them at the fact that they will look at the mirror and they will be different, right? Drastically different within a short period of time. But also, they will be different also for their loved ones, right? And that may create its own dynamics as well. All those things have to be taken into account. Of course, one extremely important part of all this process also, Kamal, is to really work with our patients to really make sure they understand the indications for bariatric surgery in their setting, right? We're doing bariatric surgery because we are finding that their weight is too high, because they have developed diabetes, because they have high blood pressure. And we have to be able to really talk to them about alternatives as well. And that's what we do when we talk about the informed consent process, is to say, right, what are my alternatives to bariatric surgery? What are the risks and benefits of bariatric surgery in my individual setting, right? That's the question the patient wants to know. And that's where we have to come in and explain that. And they have to be absolutely comfortable, right?
Mm-hmm.
I saw a patient today come out that was a little bit on the fence about whether to do bariatric surgery or not. And she is in the process, right? But then she wants to take more time to think about it. She wants to try other options as well, right? And like I said to her, this surgery is an option. It's the best option right now, but it's not something I can prescribe to the patient and say, you must do XYZ because I'm your doctor and order so. Because of the important changes that occur in an individual, a doctor, a bariatric surgeon has to work with the patient, and they both have to come to a consensus that that's the right thing to do. And for them to come to a consensus, the patient has to be comfortable. Now, granted, the vast majority of patients will have reached that point of understanding and acceptance when they come and see us, right?
Mm-hmm.
Because when the vast majority of patients, Kamal, as you know, will have thought about bariatric surgery for a long period of time before making that call or going to our website to make an appointment. In fact, on average, I think patients will have thought about bariatric surgery for 2 full years before they come to a conclusion that they need bariatric surgery. And those 2 years they are going back and forth, right? Talking to friends, doing research, coming to Bariatric Friday and listening to the two of us, talking about these issues. All that will help them mature the idea that bariatric surgery is not only important for them, but it may be the best and only option for them in terms of improving their health.
On that, I'm going to ask you, what's the best outcome you have ever seen with someone that improved the most? And you were actually maybe even shocked.
Yeah, I mean, one of the best recollections I have, Kamal, is with a patient of ours.
So we are going through the storm.
I believe that patient was he was in his mid-40s. What? Can you hear me?
I think the
Is
connection.
there a connection problem still?
Yes, I think it's the storm, definitely.
Okay.
So I'm down in Newark, you are in probably North Bloomington. So, but I think it's fine.
Okay. So the patient was, in his mid-40s, very high BMI, and they came to see us. And at that time, that patient could not really be active physically. And because of that, that patient was on disability. So they were on a Medicare disability and they couldn't work, right? One of the greatest news for me was when that patient a year later came to us and asked us to certify that they were no longer disabled, that they needed to go back to work. And one of the stories that patient told me was that the previous few months were the best in his life because for the first time, he was able to take his kids to Disney World and get on the rides with his kids because he's never been able to do that before, right? So those are great individual stories. Yeah, very simple, right?
It's so simple that you don't even think about it. And then this can become a huge challenge for people.
Yeah, absolutely. So that patient, we're no longer talking about the fact that that person is no longer taking blood pressure medication, diabetes medication. We're talking about their daily life as well. I can go to work now and be a normal working person and earn for my family, and I can take my kids and have enjoyment with them without having to feel guilty of not being able to go on a ride with them. So those are things that really make bariatric surgery worthwhile. And I think, as a physician, I feel extremely privileged to be in this field, Kamal, because it's extremely rewarding when day in and day out you hear stories like that from patients.
So I mentioned to you last week those couple patients who recently they posted on the Facebook support group, and they have their before and after pictures. And sometimes, my team here, they help me with getting prep for these events. So I feel like when I'm actually talking about it, in some cases they may not really follow or they may not believe everything that I'm saying. So, look, okay, here's the picture, and this is the same person. Actually, we actually reviewed them last Friday together after the event. So it's the transformation from before and after this is just like unbelievable. So I think it's so great that we are able to see that type of outcome, which comes with its own pros and cons, I guess, because they may have some other cosmetic issues, but we know that from the well-being standpoint, being healthier and being able to function, being able to do certain simple tasks in life, it's a life changer. And I can tell you, from my side, which I was mentioning, where it breaks my heart when I see someone who finished the process, and this is most people are going to say, well, of course, you are going to benefit financially. Well, we are going to do something financially. We are going to have that benefit from somewhere. Doesn't matter. But this is having a huge impact on someone else's life. So when I see the patient with BMI 52, finish cardiology, pulmonary, bariatrician, the EGD, and the psych, and this and that, and then boom, they are like, at the end, they are changing their mind. It's not about money anymore.
Right.
So this is about what's going to happen to this person, what's going to happen to her family or his family. So uh, that's why like it's extremely important for us to kind of understand these issues so we can actually address them. And one of the greatest things that we were able to achieve in our program is we have designated care managers. And we have daily case conferences. Nowhere else in the United States, therefore I can say nowhere else in the world, in any of the bariatric program, there is no such a discipline on a daily basis for case conference. This is the only program which has that discipline. And anyone can challenge me with that. I'm ready. The reason for it is because we know that this is extremely important and serious. And we also know that patients are so fragile with the process. They can get overwhelmed, they can get frustrated, they can get confused. That's why we build the program the way that we have. And that's why probably our outcome is much better than anywhere else. And also that's why our dropout ratio is a lot smaller than industry. So that's why patients should come in and get seen, start the process. Now, look, if someone is able to achieve the results with diet and exercise, be my guest. And then we are not saying that there won't be some miracles. There will be. Again, it's a miracle. It's a miracle. So it's just 1 in 10,000 may happen. But what we know here is this is the way to, this is the most effective tool. Therefore, this is the most efficient way to get to the result where you don't actually have to worry about going through a process that's going to make it almost impossible for you to finish. So, anything else, Dr. Irgau, from the psychological and emotional standpoint, in terms of the how patients are making those adjustments, pre and post surgical? Any recommendations you can make for them if they're not coming to our
I mean,
support groups?
I mean, the vast majority of patients are actually additional issues that could arise afterwards, but it doesn't mean that there aren't patients that struggle. There are, and the most important thing is we know that. And if we know, it means we are prepared. And who is fairly recent from surgery, and then time of surgery, loss of a loved one as well. Recovering from surgery, the grief difficult, particularly because before the surgery, food was a to-go thing for them, to help them emotionally, and then obviously that's not available. So being ready for, to email Dana at United Medical to get us help from the social workers as well, so that they could connect that patient with counseling as well, is that. And then I would be seeing that patient now, not just, at the normal every, 2 weeks in the first month or every 2-3 months. I will be seeing that patient, understanding that patients can grow through these emotional struggles, and provide the appropriate support is really part of our commitment.
And as you were saying,
to them, so obviously we are there for them.
As you were saying, the social workers actually is a great addition from our accountable care organization. So
Yep.
We actually we have seen the benefit of having those resources on board with us. So then, because the challenges are not limited with the process itself, there's other things, access, understanding their
Yep.
insurance, even like transportation can be a big problem for many of them. And then many of the patients don't know that there are benefits, including Medicaid and Medicaid managed cares. There are transportation benefits. It's just like it's an education that they need to provide, which our social workers are doing. So there are so many different things that we have, and therefore, it's one, like, again, this is one of those broader ones, so that it's really it's important for us to hear everything from the patient so we can address them. So if they're communicating with us, there's always some solution. So Dr. Irgau, because of the way that our technical situation, so I would like to actually, and we were going to wrap up anyway, so I think we are good for today, because I'm going to repeat this one in a couple of weeks anyway, a couple of months anyway. It's on the playlist for those who wants to actually see more of us. If you can sleep, you put one of our videos on, and apparently it helps you to sleep. So you can always utilize us in different ways. So again, thank you so much for joining me, and we'll be back next week with another event. We'll see you guys soon.
Thank you, everybody.